much for coming today. As anticipated, the North Bay Parry Sound District Health Unit has their first resident confirmed positive for COVID-19. The individual is a woman in her 60s who traveled internationally. This individual should be highly commended for the actions she took to protect others. She's also a great example that demonstrates the system is working. As a traveler, she was aware of COVID-19 and followed the instructions when returning to Canada. She immediately isolated herself for 14 days and monitored for symptoms. When symptoms started, the individual followed proper protocol by calling the health unit, who referred them to the North Bay Regional Health Center's Assessment Center. The health unit notified the assessment center prior to arrival in a private vehicle, whereupon she was met by staff in full personal protective equipment, was provided a mask, and isolated. After assessment, she was tested and provided further education and instructions. The individual was well enough to return home and continues to self-isolate for the remainder of the 14 days. The health unit continues to monitor her progress. The North Bay Regional Health Center's management and staff, local primary health care providers, Ontario Health, and the City of North Bay are to be praised for their exceptional work and efforts to establish an assessment and testing center so quickly. Additionally, 3 other centers have been approved within the health unit district. West Nipissing and Mattawa will be operational shortly, and Parry Sound currently is. This collaborative effort throughout the district will help to slow the spread of COVID-19 and save lives. It was expected we would eventually have a resident confirmed positive for COVID-19 within our district, and we anticipate more people will become ill with COVID-19. How many and how quickly this will occur is unknown. Sadly, we will see more cases and more people becoming ill with COVID-19. It is very likely we will have deaths as well. It will get worse before it gets better. More importantly, it will get better. Together, we all play an important role in helping to reduce the spread of COVID-19 and protect those at high risk of becoming severely ill, older people, and those with underlying health conditions. Physical distancing will help to slow the spread of COVID-19 and save lives. Protect yourself and those around you by regularly washing your hands or using alcohol-based sanitizers, not touching your face, covering your cough or sneeze, and most importantly, staying home when you're ill. I was born, raised, and returned to the North because I love our communities and the people in them, because I know that they care about each other. Every day I see people who are actually doing what we're asking them to do to slow the spread of COVID-19 and save lives. We are Canadians. When things get tough, we look after each other. That's just who we are. So thank you for all you are doing to keep one another healthy. To conclude, it is important to remember that 4 out of 5 people with COVID-19 have no symptoms or mild symptoms. Currently, there is no specific treatment for COVID-19. There is no vaccine. People who are mildly ill should isolate and care for themselves at home. Most will recover in 1 to 2 weeks simply by treating the symptoms. Notification of any future cases that turn positive will be shared through our website. So now I'll invite questions.
Doctor, you did mention the preventative measures to stop it from spreading once the individual was on Canadian soil. Are you concerned at all that it could have spread to anybody else?
No, there were preventative measures that were taken, and that's what as I mentioned, this woman should be highly commended for what she did. Right from stepping off the plane, did exactly what she needed to do. They isolated, she was isolated, traveled directly to her home, and remained there. And there were no contacts outside of
And just to follow up, are you able to be more specific than North Bay Parry Sound, or is that the general labeling of where this woman's from? Can you say where, or is that just generally North Bay Parry Sound District?
North Bay Parry Sound District, yeah. We have to say that. We want to protect personal privacy of information, but I would love to be able to say who the woman was because she did an amazing job.
When did she return from Egypt?
She returned on the 13th.
Can you explain exactly how this person traveled? I'm assuming she flew, so
Yes.
can you say exactly which flights she took, where she landed, and even, can you break it down to even the road? Because I'm sure people who travel with her might be confused.
I'd like to address that, and that's a very important question that you're raising. And what's most important to know is that the symptoms that the person developed didn't occur within the time frame that would have exposed anybody on the flight. So, the flight coming back to Canada, we look at, well, when could somebody potentially expose others? And the current thinking right now is possibly within 48 hours before they have symptoms. But for this person, they didn't have symptoms for 3 days. So this person could not have infected anybody on the flights.
Can you say which symptoms she had?
The symptoms started off, from what my understanding is, that it was a fever, and they had cough, and the regular symptoms that you'd be looking for.
And this person is at home in self-isolation?
At home, doing well, self-isolating, yes.
Okay. Did she travel with anybody?
Yes.
And have those 1, 2 people, can you specify?
It was a family member.
Okay, and has that person been tested?
That person is being isolated at home and doing well.
Does this change the risk level?
No. I think that the risk level doesn't change at all. Both did exactly what needed to be done. And I think that we do know, when you look at the rest of Ontario, there are areas that have community transmission. Eventually, we will have community transmission. It's to be expected. For every case that you know about that gets confirmed, we know that there are others that aren't even being detected.
Following up what Mike said about the plane, have you contacted other people within a couple of rows?
No, we don't have to do that simply because she couldn't have infected anybody, because she wasn't able to spread the virus at that time when she was on the flight. And we go by the symptoms and when the symptoms started. So the symptoms started way after she would have been able to have done that. We do know that some people can infect others before they were showing symptoms, and that's your point that you're raising. It's a very good point. But no, she wasn't, had that occurred, we would have done exactly that, as you've been noticing in many of the other news releases that people have, that they do look for the flight. We did investigate that specifically, and it's not an issue in this case. But had it been, we would be posting the flight, the number, the rows within that distance to let people know that that would be an issue, but it isn't here.
So just for clarification, does that mean that she was infected on Canadian soil?
That's a good question. Likely not. I don't believe that, because the person did not contact anybody, and they did exactly what they needed to do, so probably not.
What kind of message do you
And
want
may I just follow up, sorry, just to say that we do know that the incubation period is quite variable. So it could be average of 5 to 6 days from exposure. So if she was exposed 5 to 6 days later, she could get it, but it could be up to 2 weeks. So that's why
What
I
kind of
mentioned that.
message do you want to send, because there's people who are going to be scared now that we have our first case. What kind of message do you want to send to the people at home?
I think that's very good. It's a good question to ask, because, you know, we have to address fears. We have to address, and it's perfectly natural for people to feel frightened. But we also need to look at what the science is telling us. And what the science is telling us is that for most people, they're either asymptomatic or they have very mild symptoms, and they recover in 1 to 2 weeks. So yes, people are afraid, but you also have the power to do something about it. And that's why in the time that we are in within this pandemic, we can do something about it. And that is the physical distancing, that you stay away from other people to protect yourself. Everybody has to have a look at themselves to see, how am I at risk and how are the people around me at risk, and take measures that you can personally do to do that. They need to know that they have that ability to do that. And they also need to know, to help lessen their fears, is that we've been working on this for quite some time. We've been working collaboratively with the healthcare system, with the municipalities to put things in place. As you can see with the assessment and testing centers, that we were able to get functional very quickly, that help identify this person. And we're preparing for the worst in case things do get bad. And so all of these things have been done, and working together, we can all play a role.
If I can go back to this other
Yeah.
family member who traveled with
Yeah.
this woman, has that person shown symptoms or been tested at this point?
What I can say is the person is doing well at home, and for privacy issues, that's all I can really say.
As far as the number of tests that have been done,
Yes.
that the health team is aware of, I believe the latest number was 180, of which
Correct.
about 70 some odd that are still waiting for results.
Yep.
I guess, are we doing enough testing at this point?
That's an excellent question too. Ideally, in a pandemic, we would want to test everybody, but it's just not feasible to do. We don't have the testing capacity, nor do we have a number of testing kits that would make that possible. It would overwhelm the system. So given that there's a global shortage, we all know that, of testing equipment, we have to look at what tests we have available. We have to look at the capacity to do it, and then we have to really prioritize the ones that need to be tested. And when you look at it, underlying it all, that we do know, once you do know that there is community transmission, meaning that people will get the virus without any travel history or knowing where they got it from, not knowing that they were in contact with somebody that had it, that's transmission. Once that happens, and it is happening in different communities, the testing is less important, and it becomes more important to identify those that become much more ill, and the priority people that we need to test. For instance, it has come out right now, as far as testing goes, the directive right now is that it's not based on a case definition. It is based on whether or not the clinical situation, which the healthcare providers are the ones that will decide who will get tested. But if there is a shortage in certain areas, and they're working really hard to get more and more testing, not only the test kits, but working very hard to increase the capacity of the labs throughout Ontario to get more done. And what they are looking at currently is trying to increase the number of tests that they could be able to do, 10,000 a day, and then over the next couple of weeks. So currently, the priorities that we're looking at would be symptomatic healthcare workers, because we want them back in the workforce as quickly as possible, to exclude them, staff who work in healthcare facilities. And as well, we're looking at essential workers that need to be given priority to keep the infrastructure up and running. Symptomatic residents and staff in long-term care homes and retirement homes as well are important to do. Hospitalized patients admitted with respiratory symptoms are also given priority. Symptomatic members of remote, isolated, rural, and Indigenous communities. Symptomatic travelers identified at point of entry to Canada. So those are some of the priorities. I wish we could test everybody, but just not feasible.
Just going back to a timeline, are you able to recap the time or the day that the person landed in which airport? Are you able to give that information?
A Toronto person, I believe, and drove home.
And then they landed on the 21st, you said?
13th, I believe.
13th.
13th, yeah.
and then they went into isolation
right away.
right away, and that's 2 weeks.
They will have to be in for, 14 days,
Okay.
So
yes.
if they came back the 13th, when did they leave for Egypt?
When they left for Egypt?
Yeah.
I don't have that. We could find out for you, but I don't have that information, sorry.
Were they tested at the health unit here or off-site?
They were tested at the assessment and testing center that is currently located up at North Bay Regional Health Center. It's my understanding that it was Germany, I believe, but I can't say for sure.
And you mentioned the test sites. You mentioned Mattawa, West Nipissing, Parry Sound, and the hospital, so no testing's done at this building?
No,
Okay.
no. But what we have done though, because there was a shortage of testing kits, and this is again testament to everybody really working together to find solutions when there are issues. And the health unit provide testing kits. Local healthcare providers provided testing kits and combined them all and sent them up to the assessment center so that they would have what they needed.
As far as using Memorial Gardens as an
Yeah.
alternate assessment center, can you speak to whether that might actually come into effect?
Well, currently, that is going to be a decision that would have to be made with the hospital, the primary healthcare providers, to see what any issues that are currently they're facing. It's potential, it could be, and this is part of our planning, that we have it if we need it. We may never need to use it, but it's a backup. And currently they have an excellent operation up at the hospital here, and they have room to expand if they need to. And what they are doing and logistically, it makes a lot of sense what the decisions that they've made to do it there, and it's very efficient and effective way of doing it. If things change, then it's nice to know that we do have Memorial Gardens. And I really do want to commend the City of North Bay. They have been so supportive, the administration, Mayor Al McDonald, whatever we needed, they were there for us. And a big shout of thanks to them for that.
I do have a couple questions.
Sure.
Yesterday, the health unit said that it had, or was going to be reaching out to close contacts of an individual from outside of the district who had tested positive.
Correct.
Is this positive case here at all related to
No,
that?
not at all.
And then can you speak to how many of these close contacts, how many of these other individuals the health unit?
From the other?
Okay.
Yeah, the other individual, it was approximately 9 that we're following up with, yeah.
And the health unit has asked them to basically stay home.
Oh, yeah, absolutely, and that's how the system is working and works well. Once it was identified that there was a positive, then we were notified and we follow up with all those contacts, and they immediately isolated.
I'd like to hear your thoughts as well, just on your recommendations regarding parks, playgrounds, public areas like that, and whether they should close or not.
Yeah, I do think that they should close. I do think that at this point that, and people really have to do a risk assessment, I say. The whole idea that we're trying to get people to look at is, and buy into and actually adhere to, is that you need to have physical distancing. When you take people to parks and children playing in playgrounds, it may be difficult to actually do the social distancing or physical distancing. But I think there has to be some common sense with it too. I mean, with regards to the fact that, well, should somebody, not go outside and get some fresh air? I don't think that's realistic in all situations. Now I say that knowing that they recently, yesterday, are talking about the Quarantine Act and enforcing that. We don't have details on that right now, exactly to what extent that will occur. But to be clear, people that are symptomatic should self-isolate. They should remain inside. They should stay away from other people that are symptomatic. For asymptomatic that have to self-isolate, it depends really if you're talking about, are you self-isolating because you're under a quarantine order? That's different than if you are self-isolating because you may have been in contact. So I think you really have to be very careful of that. For instance, they're saying that, well, somebody going outside for a walk that is asymptomatic, I would recommend that you don't go out for a walk if it means that you're in a busy area of town where there's going to be a lot of people. Don't do it. And that's just common sense practice. But if you are in an area where, let's say, you're not going to be running into anybody, you're in a rural area, or you're in an area where you can maintain a distance, of 2 meters easily, then I think that you have to balance. There are mental health issues as well. Sometimes just getting out into, some fresh air and getting a little exercise. And I'm not saying to do that if you've been quarantined and under legal order.
Some of the states, New York, California, are now going into lockdown, I believe.
Yep.
They're going to enforce it strictly.
Yep.
Should Ontario, Canada maybe even impose a national or provincial-wide quarantine?
That's always a possibility, and certainly beyond what I would have the authority to do. It really depends on how the situation progresses, and it possibly could get to that.
We've heard the Prime Minister, various premiers, basically calling out people who are smokers, for example, are flying in and not self-isolating right away, or just people generally gathering in large in public spaces. Specifically here within the health team, do you believe people are taking this seriously?
I really do, and I think that all you have to do is drive around when we're coming to work, because essential workers have to be here. We try to encourage as many people as possible not to come to work and work from home if you can. Some people just can't do that. They have to be at work. But just seeing the reduction in the number of travelers, the number of people on the streets, it is working. And I think people are really taking this seriously, and really proud to see that happening.
And do members of the same household have to self-distance?
That's
They're in the same house?
That's a very good question. If somebody is symptomatic, then yes, we recommend that. I mean, you obviously have to care for the person, but to follow the proper procedures, and there's lots of information on our website on how to do that, how to self-isolate when somebody is sick within the home, and what you can do. But yes, as much as they can stay away from others as possible, but obviously be taken care of. And there are certain practical things to do, and not to share thing in particular. But yes, it can happen, and we can help you with that.
Maybe if you can reiterate what people can do now if they believe they've come in contact with somebody, or if they start feeling symptoms, just reiterate what they should be doing.
Sure. If somebody feels that they've come into contact, the first thing that they should do is they can go to our website. There's a self-assessment tool. Work through that. And if you still have questions, work through the self-assessment tool, then give us a call and we can talk about your specific situation. If somebody is having symptoms, and that's the issue, because the symptoms that you have can be very similar to flu symptoms, very similar to cold symptoms. But given what we're dealing with, if you do develop symptoms, you really should immediately self-isolate and then give us a call. Now, if somebody has severe symptoms and feels that they need emergency care, absolutely, you get it, and you call 911 if you have the severe symptoms. But for most people, that's not going to be the case. So isolate yourself, and we can help work it through.
And if it's severe, alert the paramedics or alert dispatch that you have some kind of severe symptoms and that they should be aware as well? Exactly,
and that's the message that we're getting, and that they would ask about that too, so they can protect themselves. That's a very good point.
If I could ask about homeless shelters, for example, I've seen the crisis center it's been at capacity for some time.
Yeah.
The center is serving more meals. They've also moved into a larger space to accommodate more people. What would your recommendation be to those types of facilities as far as, and perhaps a risk factor as well to people who are homeless?
Yeah, certainly people who are homeless are at increased risk of getting this, but their basic needs and need to be met too. So however safely that can be done is being done, and we certainly commend the efforts, and everybody is working together. The health unit in conjunction and partnership with these organizations to help ensure that they get looked after. It's not easy, it's very challenging, and it's very difficult sometimes to always maintain that 2 meters. We really advocate that they do, but we also have to be realistic that, you know, people have to have food and shelter, and they're doing their very best to do that.
I could ask one question.
Sure, Michael, sure.
I mean, a horrible.
No, that's fine.
So today, this morning, the Ontario government announced that there were 170 new cases or confirmed positive cases of COVID-19, which I believe is the single largest increase that the province has seen so far in a day. I'm curious to know whether the healthcare system currently at this point, in your view, has the capacity to deal with what we have right now. I mean, I know there have been call-outs for more personal protective equipment, for example, for donations to be made. Or do we have the capacity right now to deal with this?
Right now, yes. Right now, I'm confident that we are seeing those that need to get the care that are actually being provided the care that they need. Could it get worse? Possibly, it could. And that's why it's so important now, early on, where we're not seeing the acute care system becoming overwhelmed and the intensive care units, that's why it's so important for each of us to do our part, to do the physical distancing, so that it doesn't become overwhelming. I also want to go back to say that the public, especially within our health unit district, have been absolutely phenomenal when respecting the emergency department use, and they are being freed up to look after those that are really sick. And so thank you for that. It is working, and we hope that it continues to work so that the acute care system isn't overwhelmed.